With a recent mass shooting in California, the topic of mental illness is one that's just not going away. And so joining us this morning is clinical psychologist Dr. Ralphi Wald, who says more really has to be done. And this is interesting in terms of funding. You've got to throw some money at this problem.
Yeah, absolutely. I think what needs to happen is we need to come at this from a community psychology standpoint. Community psychology is the field of psychology that deals with psychological issues that are going to happen in the future. In other words, it's community psychology. You go into the community and you try to identify those people that are at risk of having psychological problems in the future. And I think that the same way that we have a Department of Homeland Security, I think that we're going to need to have enough funding to have something like a Department of Mass Casualty Prevention, in which there are districts throughout this country and people who are responsible for developing relationships with people that are in their district, like school principals, teachers, government officials in that area, so that if people have concerns, they can go to those people. And I think that also monitoring social media is going to be very important if there were such a department, because there's so frequently signs that pop up on social media that if someone understood, they could have done something about it. Monitoring
social media, time consuming, and that takes jobs, efforts, money, as you mentioned.
It's going to take money for sure.
Okay. Let's go to mass shootings. It seems like at this point, it's not even year after year anymore, but in some cases, month after month. Do mass shootings breed mass shootings?
So there's a classic social psychology experiment that was conducted by a famous psychologist named Albert Bandura. And basically what he showed is that if you show children images of people being violent, then they're going to be much more likely to be violent in the coming minutes and hours. So unfortunately, seeing violence does, on average, make a population more violent. Yes.
Authorities say the California gunman, he was a Marine vet, suffered from PTSD. Talk about signs, symptoms that just the general public can look out for.
Sure. Symptoms of post-traumatic stress disorder after a person experiences, generally it's a life-threatening kind of an experience. People will experience hypervigilance, which really just means that if you hear a loud noise, it's going to startle you much more dramatically than it would otherwise. People that have PTSD have nightmares and daytime flashbacks that relate to the trauma that they experienced. Those are generally the main symptoms that people experience, but it's so common that a person who suffers from PTSD will also have other psychological problems come along with it, like depression, for example. So it's a very difficult problem that the VA has been dealing with forever.
And then when you notice those signs, what do you do? And this may sound kind of elementary, but you call 911? Do you get in touch with local law enforcement first? Do you go to the family doctor? Where do you start?
That's a great question, and I think it depends on the person that's being affected and how severe what's happening to them is. I, as a psychologist, and other mental health professionals, other psychologists and psychiatrists, if we are hearing about someone who may be at risk for something, we are bound very tightly by the concept of privilege, where unless we have direct information that a person is planning to hurt themselves or hurt someone else, we cannot contact someone else about it. We have to respect the patient's privacy. However, we can obviously encourage that person and do everything in our power within those rules to have them seek help.
Do you see those laws loosening a bit, though, in light of everything that's going on?
Not even a little bit.
Not even a little?
Not at all. Confidentiality and when to breach confidentiality is one of the most complicated issues, and it leads to burnout in mental health professionals very, very frequently. So it's one of the biggest problems that we face.
That you all face. Well, Dr. Wald, we'll leave it at that. Thank you so much for coming in.
Thank you.
We appreciate it.